Yes.
Good afternoon, ma'am.
Good afternoon.
My name is Sharonda, and I'm your student nurse today. I've been instructed to come do a head-to-toe assessment on you. Is that okay?
That's fine.
Great. All right, so I'm going to go wash my hands, provide for privacy, and I'll be back shortly, okay?
Okay.
All right. All right. Okay, so first we're going to start off with you verifying yourself and your date of birth for me, please.
Brenda Hicks, January the 9th is my birthday.
Thank you very much. And where are we located?
Hidden Lake Hospital.
Great. All right. Patient is oriented ×3. Good job. Okay. And I just wanted to ask you before we get started, what is your pain level from 0 to 10?
About 1.
About 1?
Mhm.
Okay. All right. Not bad at all. So first I'm going to start by assessing your head for any lacerations or bruises. Okay. All right. So patient seems to show no laceration or bruises or abnormalities at the head. All right. And if you can, please, can you raise your eyebrows for me? Great. All right. Can you smile? And can you poof your cheeks for me? Great. So sensation is intact. All right. I'm going to start by looking at your ears and looking for any discharge or abnormalities. Great. All right. So ears are equally bilateral. No discharge, no abnormalities found. All right, and I'm going to start by looking at your pupils and testing for dilation and constriction, okay?
Okay.
All right, if you can, just look straight back over my shoulder. Okay. Great, so pupils are 3 centimeters and responding well to light. Okay, and if you can, tilt your head back a bit for me. I'm going to look at your nasal passages for any irritation. Nasal passages are clear. No abnormalities, no discharge. Great. All right. Can you open your mouth for me? All right. Okay. Mouth seems to be good. Membranes are nice and moist. No abnormalities, no lesions. Good job. All right. Okay, Miss Hicks, so we're going to do a test here. If you can, just continue to look back for me and just follow my finger. Great. And we're going to do this on the other side as well. All right. Now, if you can, close your eyes for me. I'm going to whisper something into your ear. You can just repeat back what I said to you.
Okay. Bagel.
Okay.
Puppy.
Great. All right. Continue to keep your eyes closed for me. And if you can, please tell me where you feel my finger touch.
Nose. Cheek.
On which side?
Left.
Okay.
Right cheek. Forehead.
Great. So sensation is intact. All right. I'm going to check now by I'm going to start by checking your carotid artery. Perfect. All right. So pulse is nice and strong. Beautiful. I'm going to check your brachials. Okay, pulse is nice and strong and bilateral 2+. And if you can, please turn over your hands for me. I'm going to check your radials. Okay, radials are nice and strong, bilateral 2+. Okay, then I'm going to look at your capillary refills here. Okay. Capillary refills under 3. Okay, I'm going to check your skin for any lesions or lacerations. Alright, skin seems to be well nutritioned, warm to the touch, nice color. Great. Okay, and I'm also going to test your posterior tibial pulse. Great, pulse is nice and strong, bilateral +2. Alright, your dorsalis pedis. Nice strong pulse, bilateral +2. Alright, check your capillary refills in your toes. Great, capillary refills are bilateral and +2. Alright, and if you can, please lift up your leg for me and I'll check your popliteal pulse. so popliteal pulse is nice and strong, bilateral +2. All right, Ms. Hicks, now I'm going to go ahead and check your pulse and your lung sounds. I'm sorry. All right, and if you can just take a deep breath as my stethoscope moves. Okay, second intercostal space, right sternum border, aortic. Beautiful. Second intercostal space, left sternum border, pulmonic. Okay. Third intercostal space, left sternum border, Herb's point. Okay. All right, gotta lift up your shirt here for a little bit, Ms. Hicks. Fourth intercostal space, left sternum border, tricuspid. Okay. And fifth intercostal space, left sternum border, anticlavicular. All right, nice. Okay. All right, so now I'm going to assess the back for lung sounds. And if you can, please just take a deep breath as I move my stethoscope.
I sure will.
Beautiful. All right. So sounds are nice and clear. AP is 2 to 1. And if you can just hug yourself for me as far as you can go back. All right. Spine is nice and strong and aligned. No deformities noted. Beautiful. All right. So now I'm going to test your strength, Ms. Hicks, if you can, please. Well, first we're going to do your range of motion. Stick your arms out to the side for me and put them in a circular motion toward me. All right, and back the other way. Okay, and if you can, arms to the front, arms back to the side, and arms behind you. Beautiful. All right, and if you can, please stick your arms back out for me. I'm going to try to push your arms in, try to push against that. Beautiful. I'm going to try to push out, push against it. I'm trying to push out, so you push against it. There we go. All right, so we're going to do the same thing with your legs. I'll try to push in, so you push against it. I'll try to push out, push against it. Beautiful. So strength is nice and strong. All right, if you can, stand up for me. All right, if you can turn towards this way and walk 4 steps back. Beautiful. And can you walk 4 steps forward? Thank you. All right, and can you just stand and close your eyes for me? Nice. And can you just lift up your right leg towards you? Okay. What about your left leg? Okay, so patient gait seems to be nice and steady. Okay, you can have a seat down here for me, Ms. Hicks. All right, so now I'm going to assess your abdomen. If you can, just lay back for me and turn this way. No, turn this way. There we go. All right. Okay, so stomach is nice and flat and symmetrical. I'm just feeling for any lumps. Okay. Or abnormalities, which is nice and flat. Everything is good to go. All right, so we're going to start with the right lower quadrant. Right upper quadrant. Left upper quadrant, left lower quadrant. Okay, vowel sounds sound nice and clear. All right, and if I can ask, when was your last bowel movement?
This afternoon.
Great, and did you have any discomfort or any abnormalities noted?
No, I didn't.
Okay, and when was your last urine?
About an hour ago.
Okay, did you notice any abnormalities, burning sensations, or discomfort?
No, not as I know
Great. Okay. All right. So if you can just stand up or sit up on the bed for me. Great. And did you have any more questions for me?
No, not today.
Okay. Well, this has concluded our head to toe assessment. I'm going to go record my findings. I'm going to leave your call button here.
Thank
Just
you.
in case you have any questions or need some assistance with anything. And if that's it, I'll be back to check on you later, okay?
Well, thank you so much, Miss Sharada. You have a wonderful day.
Thank you. You too.